What is schizophrenia? The word schizophrenia comes from the Greek word schism, meaning to split, and the Greek word phrenos, meaning heart, mind. The Swiss psychiatrist Eugen Bleuler coined the term schizophrenia in a lecture in Berlin on April 24, 1908. Schizophrenia is a chronic, severe, and disabling brain disorder that has affected people throughout history. People with the disorder may hear voices other people don't hear. They may believe other people are reading their minds, controlling their thoughts, or plotting to harm them. This can terrify people with the illness and make them withdrawn or extremely agitated. People with schizophrenia may not make sense when they talk. They may sit for hours without moving or talking. Sometimes people with schizophrenia seem perfectly fine until they talk about what they are really thinking. Families and society are affected by schizophrenia too. Many people with schizophrenia have difficulty holding a job or caring for themselves, so they rely on others for help. Treatment helps relieve many symptoms of schizophrenia, but most people who have the disorder cope with symptoms throughout their lives. However, many people with schizophrenia can lead rewarding and meaningful lives in their communities. Researchers are developing more effective medications and using new research tools to understand the causes of schizophrenia. In the years to come, this work may help prevent the better treat the illness. Schizophrenia is a psychotic disorder or a group of disorders marked by severely impaired thinking, emotions, and behaviors. Schizophrenic patients are typically unable to filter sensory stimuli and may have enhanced perceptions of sounds, colors, and other features of their environment. Most schizophrenics, if untreated, gradually withdraw from interactions with other people and lose their ability to take care of personal needs and grooming. The prevalence of schizophrenia is thought to be about 1% of the population around the world. It is thought more common than diabetes, Alzheimer's disease, or multiple sclerosis. In the United States and Canada, patients with schizophrenia fill about 25% of all hospital beds. The disorder is considered to be one of the top 10 causes of long-term disability worldwide.
Description: the course of schizophrenia in adults can be divided into three phases or stages. In the acute phase, the patient has another loss of contact with reality, a psychotic episode that requires intervention and treatment. In the second or stabilization phase, the initial psychotic symptoms have been brought under control, but the patient is at risk for relapse if treatment is interrupted. In the third phase, the patient is relatively stable and can be kept indefinitely on antipsychotic medications. Even in the third phase, however, relapses are not unusual and patients do not always return to full functioning. The English term schizophrenia comes from two Greek words that means a split mind. It was observed around 1908 by a Swiss doctor named Eugen Bleuler to describe the splitting apart of mental function that he regarded as the central characteristic of schizophrenia. Causes play a role in the development of schizophrenia. People with a family history of schizophrenia who have a transient psychosis have a 20 to 40% chance of being diagnosed 1 year later. Genetic estimates of heritability vary because of the difficulty in separating the effects of genetics and the environment. If one parent is affected, the risk is about 13%, and if both parents are affected, the risk is nearly 50%. One idea, assuming an hereditary basis, is that genes are involved in the evolution of language and human nature, but today such ideas remain little more than hypothetical in nature.
Environmental factors associated with the development of schizophrenia include the living environment, drug use, and prenatal stressors. Parenting style seems to have no major effect, although people with supportive parents do better than those with critical or hostile parents. Childhood trauma, separation from one's families, and being bullied or abused increase the risk of psychosis. Living in a new urban environment during childhood or as an adult has consistently been found to increase the risk of schizophrenia by a factor of 2. Even after taking into account drug use, ethnic group, and size of social group, other factors that play an important role include social isolation and immigration, related to social adversity, racial discrimination, family dysfunction, unemployment, and poor housing conditions. Substance use. About half of those with schizophrenia use drugs or alcohol excessively. Amphetamine, cocaine, and to a lesser extent alcohol can result in psychosis that presents very similarly to schizophrenia, although it is not generally believed to be a cause of the illness. People with schizophrenia use nicotine at much greater rates than the general population. Alcohol abuse can occasionally cause the development of a chronic substance-induced psychotic disorder via a kindling mechanism. Alcohol use is not associated with an earlier onset of psychosis. A significant proportion of people with schizophrenia use cannabis to help cope with its symptoms. Cannabis can be a contributory factor in schizophrenia, but cannot cause it alone. Its use is neither necessary nor sufficient for development of any form of psychosis. Early exposure of the developing brain to cannabis increases the risk of schizophrenia, although the size of the increased risk is difficult to quantify. Only a small proportion of early cannabis recreational users go on to develop any schizoaffective disorder in adult life, and the increased risk may require the presence of certain genes within an individual or may be related to pre-existing psychopathology. Higher dosage and greater frequency of use are indicators of increased risk of chronic psychosis. Tetrahydrocannabinol and cannabidiol produce opposing effects. CBD has antipsychotic and neuroprotective properties and counteracts negative effects of THC. Other drugs may be used only as coping mechanisms by individuals who have schizophrenia to deal with depression, anxiety, boredom, and loneliness.
The types of schizophrenia are paranoid type schizophrenia. It is characterized by delusions and auditory hallucination, hearing voices that don't exist, but relieving normal intellectual functioning and expression of emotion. The delusions can often be about being persecuted by a person or feeling outraged or treated unfairly. People with this type can exhibit anger, aloofness, anxiety, and can be argumentative. Disorganized type is schizophrenia. It's by speech and behavior that are disorganized or difficult to understand, and flattening or inappropriate emotions. People with this type of schizophrenia may blush inappropriately for no apparent reason, make illogical statements, or seem preoccupied with their own thoughts or perceptions. Residual type of schizophrenia is characterized by a past history of at least one episode of schizophrenia, but the person currently has no positive symptoms such as delusions, hallucination, disorganized speech, or behavior. It may represent a transition between a full-blown episode and complete remission, or it may continue for years without any further psychotic episode. Catatonic type. The subject can be almost immobile or exhibit agitated. Symptoms can include catatonic stupor and waxy fluxivity. Post-schizophrenic depression. A depressive episode arising in the aftermath of a schizophrenic illness, where some low-level schizophrenic symptoms may still be present. And the last one, simple schizophrenia. Insidious and progressive development of prominent negative symptoms with no history of psychotic episodes.
Signs and symptoms. The symptoms of schizophrenia fall into two categories: positive symptoms and negative symptoms. The positive symptoms are psychotic behaviors not seen in healthy people. People with these symptoms often lose touch with reality. These symptoms can come and go. Sometimes they are severe and other times they are hardly recognizable. Among the positive symptoms we have hallucinations, are things that a person sees, hears, smells, or feels that no one else can sense. Voices are the most common type of hallucination. People with schizophrenia may hear voices for a long time before family and friends can notice the problem. Other types of hallucinations include seeing people or objects that are not true and do not exist. Delusions are false beliefs that are not part of the person's culture and do not change. Schizophrenia people may think others talk about them or are planning to harm them. Thought disorders. These are unusual ways of thinking. This is when a person has trouble organizing his or her thoughts logically. And movement disorders. A person with a movement disorder may repeat certain motions over and over again. In the other extreme, a person may become catatonic. This is a state where a person does not talk or moves for hours. Negative symptoms are associated with disruptions to normal emotions and behaviors. These symptoms are more harder to recognize than the positive symptoms. Among the negative symptoms we have lack of pleasure in everyday life, lack of ability to begin and sustain planned activities, speaking little even when forced to interact. People with negative symptoms need help in everyday tasks. To finish, schizophrenia is a chronic, severe, and disabling brain disorder that has affected people throughout history. It mainly affects teenagers and young adults, and with a good treatment, schizophrenia patients can have a happy and normal life. If you meet someone with this condition, you should be understanding and kind to him or her. I hope you liked the presentation. Thank you.